Hello, and welcome to another presentation in our series of Supremus Group's Patient Awareness Briefs. Each one of these 15-minute sessions addresses a topic of direct importance to you as a consumer of healthcare services and explains an aspect of the regulations as how they deal with how you should be informed and engaged in the healthcare delivery process. This session is going to cover the topic of covered entities and business associates, two different types of organizations or individuals that are involved in the healthcare process, and what these names should mean to you. So let's get started. Slide 2. So looking at our topic agenda for today, we're going to talk about your health information and how it is used, who handles it, what a covered entity is and what it does, what a business associate is and what it does, and how you can get informed and get engaged. Slide 3. Your health information is collected, used, and disclosed by the doctors, dentists, and other professionals who provide care for your health. This information is vital to these providers to keep track of your medical history and the claims filed for it. The law requires that they exercise caution in handling it and using it, and places requirements on them to protect your information and conditions on how it will be used and shared. In this session of our series, we'll discuss that information and who the covered entities and business associates are that use your information in this process. Slide 4. So here we see that there are different types of information. We have the most broad category called health information, and this is what you might call the universe of all possible information. We have individually identifiable health information, which is all the things that are about you and about your health that are directly traceable to you. We have a smaller form of that known as protected health information. This is usually the electronic version of the individually identifiable health information. We have ePHI, which uses another term for PHI. And then we have patient identifiable information. Now, each of these different types of information contains different elements, and they're used for somewhat different reasons. Slide 5. As you see by this slide, the elements of this information have about 18 total ingredients in the list of informational elements. And as you can see, they are all the things that identify you and associate your identity with your health information. So you should take some time and study this particular list for a minute or two so that you know exactly what's included. Slide 6. So who is this thing called a covered entity? Well, a covered entity, as defined by the law, the Administrative Simplification Rule, it is a provider or an organization that collects, uses, and discloses your individually identifiable health information, including all of those elements that you saw in that previous slide, and uses them in the electronic transactions that are processed to get the healthcare services you receive paid for. They're an entity, or they could be an individual doctor, to whom all of the rules of this HIPAA law apply. Slide 7. Within this category called covered entities, a number of different business types exist. It includes any entity involved in healthcare treatment, payment, or healthcare operations, and are involved in sending or receiving or in any way handling these covered transactions. This is the electronic message that carries information about services that you've received to your health plan or to the Centers for Medicare and Medicaid to report what's been going on and making sure that it's properly reported and paid for. These covered entities include three different types of organizations. One is your health plan, that is, the health insurance that you have normally through your provider or on an individual policy. The healthcare providers themselves, who are involved in this electronic transactions process, and a thing called a healthcare clearinghouse. This is a provider of services to these others for purposes of billing and coding your information into these electronic transactions. Now, each of these is referred to as a covered entity, and each of these must abide by all the applicable parts of this particular law. Slide 8. A provider of medical or healthcare services or any other person of the organization who furnishes bills or is paid for by healthcare in the normal course of business is considered to be a provider. However, a covered entity may be a provider, but a provider may not be a covered entity if they're not involved in the creation, use, or any other form of manipulation of these electronic transactions. If, for example, you're a chiropractor and you deal only in cash or in payment cards but don't bill any insurance in any way, then you're not a covered entity. If you're a staff physician who works for a hospital and you don't do any billing on your own but are a salaried employee, you too are not a covered entity. Healthcare itself is, of course, defined as providing care services or supplies related to the health of an individual that may be dispensed by any of these parties, known as providers. Slide 9. A health plan, which is the name under HIPAA for any sort of an insurance company providing health insurance, these plans include any form of commercial or self-insured group health plans, which includes employee welfare benefit plans, usually given to you by your employers. It can be part of ERISA, the Employee Retirement Income Social Security Act. It can be a government health plan, TRICARE for dependents, the Veterans Administration for veterans. It can be Medicare, it can be Medicaid, or it could be what is called a state high-risk pool that combines a number of different insurance companies that are sharing the risk and providing insurance for those who have particularly hazardous or unique jobs. Slide 10. Health plans also include a health insurance issuer. They include HMOs, the health maintenance organizations. Kaiser Permanente is an example of one of those. Issuers of long-term care policies except for fixed premium nursing home plans, or any other form of health insurance provided by an insurance company or a state-sponsored or subsidized plan. Now, HIPAA excludes all other forms of insurance from the coverage of this law. That includes workers' compensation. Workers' compensation typically has its own rules, and HIPAA does not add any conditions to workers' comp because that would simply complicate matters. It also doesn't include any other form of insurance, and that means it does not include life insurance. Slide 11. Now, the covered entity is a group that is the primary care provider for you, the primary insurer of that care, or someone who assists in processing all of these transactions. And it is the fact that they are all involved in the transaction process that makes them this thing called a covered entity. Now, these covered entities typically have what you might call a contractor providing services to them. This contractor to these covered entities is called under this law a business associate. So who are these business associates? Well, as I just said, they are companies or individuals that are providing these support services to covered entities. However, If they are a contractor that does not handle this electronic health information, they're not a business associate. If they are a trading partner, which is one of the others working with a provider or a health insurance offerer, these are themselves not business associates because they're peers. Now, between the covered entities and the business associate will exist a contract, and the contract, like all contracts, will spell out exactly what each party is to do in support of the other, who's going to get paid, who's going to provide what services, and so on. And the law requires that this agreement exists between these two parties. Slide 12. Now, the original HIPAA law, passed in 1996, included a number of different business types as business associates. The HITECH Act, passed in 2009, added a number of business types to the same list. Newly added ones are regional health information organizations, health information exchange organizations. These organizations connect multiple providers, hospitals, doctors, and allow for the exchange of transactions, health information, and the electronic movement of healthcare records across a secure network. E-prescribing gateways and forms of electronic prescription writing, and this thing called a personal health record. Through certain vendors of software, or through your provider, or through a local hospital, you may have an electronic portal or other form of software tool that allows you to collect and control your own health information. This is typically what you would call a personal health record system, and this is also considered to be a business associate because they allow these providers to do certain things with this information while the provider of this software supports that effort. Slide 13. Now, under the original law, the business associate had no direct regulation. The covered entities were given the mandate by the law to enforce the compliance conditions that they had to endure and meet on the business associates who they had on contract to themselves. Well, with the HITECH Act, passed again in 2009, that rule was changed, and all the conditions that were put on your providers or your hospitals now became directly applicable to the business associates. And so now we have, instead of two different sets of rules, we have a single set of rules for every party, covered entities, business associates alike, so that your information flowing between these two as part of the normal business process of healthcare delivery and payment must be handled in the same way and protected in all the same ways by each participant. This makes it much more uniform in the way that your information is collected, used, and disclosed, and, just as importantly, protected and kept secure from exposure to people who are not authorized to have access. Slide 14. So who are they now? Well, we have a refined definition of the business associate. They are an organization or an individual who creates, receives, maintains, or transmits this protected health information. They could be doing this for a function or activity regulated by HIPAA, and they're doing it on behalf of a covered entity or what we know as the network. Its formal name is Organized Healthcare Arrangement, but we know it as the network. A business associate could also retain most of the second part of the definition of a business associate, and they could be providing services along the lines of legal, actuarial, accounting, or other sorts of business services that are normally provided to hospitals, providers, all of whom are covered entities. by these business associates. And again, the same rule applies. The business associate in these cases will normally have access to this protected health information of yours as a part of the job that they're doing for the covered entity. So the business associates now include these different types. But also, they could also include what we know as a subcontractor to the business associate. Now, the subcontractor to the business associate is basically a business associate to the business associate. They are doing all of the same things in support of the business associate that the business associate itself is doing in support of the covered entity. Slide 16. So this is who the subcontractor is. But all the same rules apply to the subcontractor just like they do to the business associate and to the covered entity. Slide 17. So all of the rules that have been in existence for the covered entities since the beginning of HIPAA back in 1996, all of those rules now apply to all of these same parties. Why is this information important to you? To know who these covered entities, providers, business associates, and subcontractors are? Well, there are too many organizations to know individually. But what is most important for you as a patient is to know that the flow of your information between these different parties, if it's under normal circumstances, it's all part of the normal process of providing health care to you, giving you the medicines, the supplies, the treatments, and so forth that you require to maintain your health at its best state. But to provide this information for purposes of getting it paid for through your health plans and providing information that government and other agencies need to fulfill their duties of managing and protecting public health. It's important for you to know that these different parties have access to your information and that their access is legitimate because there are so many of them. But because it's your information, you need to be aware that despite their best effort, this information can end up going astray or being obtained illegally by other parties. And these agencies and these providers, covered entities and business associates alike, will all give it their very best effort to protect your information because they're concerned for your safety as well as for your health, and they will do their very best. So they follow all these rules. Slide 18. Because they recognize that as the patient, you are of central importance in managing your health care and the information associated with that process. As the patient, you have a great deal of control over your information, but it's important that you're aware that the normal process requires that a number of people handle it for legitimate reasons. Your providers, therefore, must make many different uses of your information to ensure they're providing the very best care and properly filing claims to get it paid for. But occasionally something will go wrong and the information will go astray. So, you need to be an active team member, participating, encouraging, learning, giving feedback when necessary, asking questions when necessary. And that means you need to learn what they do with that information and hold them accountable for doing it, using it properly, and always protecting it from misuse. So, once again, we encourage you to get informed and get involved. This information is about you. It's about what you need to know in the way of how this information is used and who uses it, and the purposes that they use it for. If you have questions, your first best point to ask those questions is at your provider's office. They're a great source of information as well as the care that you receive. So we hope that you have found that this information is valuable and useful in helping you make the very best decisions regarding how you will manage your participation in this healthcare delivery process. And thank you for joining us.